disease increased 148%. It's outpacing all of the other kind of diseases that we look at today. So it is a changing environment all the time. And by having these symposia like this, you can do some help to give you an opportunity to try to keep up with a field that's extremely changing. So thank you for coming.
Thank you, Dr. Reeves. And this wouldn't be happening. We wouldn't have the quality of speakers that we're able to bring here tonight without your support, both your treasures and your talents. I mean, you really bring a lot to our program, and we're very grateful to you for that. I know that the food was a hit because we are running out of things, so that is fabulous. I want to take a second to thank Michaela and her staff, and Lisa. Where's Lisa? And Lisa for also our dietitian helping us to make this healthy brain food for you, so you're able to pay good attention and learn lots of things tonight. I also want to take a moment to thank Katie. Katie. There's Katie. Katie is our special programs coordinator, and this is her first time to be an employee and working with us at Memory Matters. So I'm super grateful for all the effort and work that Katie does to help make things run smoothly. So thank you, Katie. All right, I want to now introduce Dr. Timothy Steele. He is the president and CEO of Associated Audiologists, Inc., a private practice audiology clinic in the Kansas City area with 8 clinics, including one in Manhattan. Dr. Steele received his undergraduate from Kansas State University. Notice the lavender tie as well. And his master's and PhD from the University of Kansas. He did his doctoral research in and has co-authored chapters on hearing loss rehabilitation. Dr. Steele is engaged in state, national audiology professional organizations, serves as an ad hoc graduate faculty supervisor at KU, sits on advisory boards for Here to Help, the HUB Argentine, and KU School of Allied Health Professionals Board of Advocates. On a personal note, Tim has been known throughout this state for his exceptional leadership and advocacy for the fields of audiology and speech-language pathology. Some of you also may know Tim's younger sister, Dr. Sandra Killingsworth, who works at Stormont Vale. And then we just learned tonight also that he was homecoming king. When he was in high school. All right, well, we thank you so very much for being here, Dr. Steele.
All right, every audiologist needs to make sure they're heard. So can everybody hear me? This is the universal sign for I can't hear you. So I see one in the back. See if I can raise it up a little bit. Thank you. Let me get started here. And so why am I here? Apparently, it's because of my sister. I might, if there's a little bit of feedback, maybe I'll use the other one. But actually, thank you for having me. I'm probably here because Michelle asked me. And you might wonder why an audiologist is speaking with you today. All right, we'll try that. You might wonder. Like, how about there? Maybe it's where I'm standing. That's like an audiologist nightmare. Feedback from the microphone. So you might be wondering why an audiologist is here. And I have to say, if you would have asked me at the beginning of my career, I would have the same question. So one of the things that I hope you will gain from the presentation today is a little bit more information about why your hearing might be related to memory. I have some interesting sort of information in my life that has come had hearing loss. And her two daughters, Chris knows this. This is my own kind of family personal story. One wore hearing aids for most of her life. The other one did not. The one who did not ended up with advanced dementia. The one who did is 102 and still living independently. So those are some little things that, you know, kind of stick with you and you begin to kind of wonder about. When I did my dissertation research, I was focused on how to rehabilitate hearing loss and how to use education as a way to help. And we did a screener. So all of the candidates for my study had to go through a screening, and that included a cognitive and memory screening. And about half of the candidates for my study didn't qualify because of that. So again, way back when, I was wondering, this is interesting. And I needed people to participate. So I was always kind of frustrated when they didn't qualify. So I'm going to also ask why you're here. And that might be unique for each of you. Maybe this is a topic of personal interest to you. Maybe it's because you know somebody. Maybe it's because you know my sister and you came to see me. You know, I don't know. But I hope you will walk away with a few helpful pieces of information tonight. And I guess my biggest goal is that I hope you can make sure you're living your best life. And I think we take for granted how our hearing is a part of that. So here is the kind of our agenda tonight. Hearing and hearing loss. We'll briefly talk about how the ear works. We're going to talk a little bit about how hearing is related to memory, negative effects of untreated hearing loss, and what can be done. We're going to start with some trivia and maybe a little bit of memory. 40th President of the United States, born and raised in Illinois, first president known to wear hearing aids in office. I thought I heard somebody say it louder. You get a prize. Ronald Reagan. Like it's when I get close to that camera. Okay, second trivia. Academy Award winning, most recognizable ears in the world, debuted in 1928. I always wondered if Mickey needed hearing aids, that would be hard to fit. We're going to just briefly talk about the ear and how we hear. So just a quick lesson back to maybe your biology classes. Outer ear, which funnels sound. The middle ear, with the eardrum and the smallest bones in your body, the ossicles, that gather that sound and move it, turns into movement. And then that is sent to the inner ear, the cochlea and the auditory nerve. It's a fascinating, complicated system, and things can go wrong along that whole pathway that can cause us challenges with our hearing. What we forget, and this happened to me in school, we really hear with our brain. And in the center, you'll notice a little white spot in the center there, known as the auditory cortex. That's where all the magic happens when it comes to our hearing. Now, there are many other parts of the brain that it's not just that one spot. We know there are networks all around the brain that help us hear. But I don't want you to forget them. So, how does it all start? Like this. When you were born, it was blank, a blank slate. There wasn't anything going on yet. And you actually begin to have sound, have meaning with first sounds that you heard as a baby. Your parents talking to you with baby talk, and you probably watching them very closely because we use our vision to hear. And we watch formations of, what's known as kind of baby talk. That's how babies learn to talk. So you're listening to voices, you're hearing songs, you're taking sounds in your environment, you're starting to listen, you're starting to talk. There's meaning assigned to the sounds that you hear. That then leads to the next thing, which is reading, about third and fourth grade, where you start to see a letter, and that means something to you with a sound. Many people don't know this, but when you read, your auditory cortex lights up as if you're hearing. Even if you're reading to yourself, you actually your brain is acting as if it's hearing a voice. That's your own voice in the head. That leads to processing and even emotion. And this is always kind of an interesting thing to think about, but can you hear a song and it takes you back to a time? Can you hear, maybe a child cry and that makes you, have a certain reaction to a child cry? I hope this doesn't happen often, but if you hear a siren behind you when you're driving, your heart rate speeds up. So we have sound that also ties to emotion. Michelle, are you still getting any echo, or is it, I hear a little here, but I can't quite. One thing just when you take a bite, one thing people are not very forgiving about is sound quality. If you watch a show, you'll be forgiving about the vision of the show, if it's a little blurry or whatever, but you're not very forgiving about the sound quality. So hopefully you can bear with me. So the point of this is to kind of begin for you to think about how sound builds meaning, and that's all tied to memory. Are you with me so far? Now, we're going to talk a little bit about the demographics of hearing loss. Hearing loss is very, very common. The reason we don't always know that is because it's an invisible disability. You don't see this disability, okay? But on this slide, and in the essence of time, I'm not going to go through all of these. I just wanted to point out a few of these kind of important facts. 15% of American adults age 18 and older report some trouble hearing. 1 in 8 people in the United States 12 years or older have hearing loss. Nearly 25% of those 65 to 74 and 50% of those over 75 and older have some form of disabling hearing loss. So it's very common. And I think that's just a stigma that is important for us to all recognize and get over. The biggest challenge that I face as an audiologist, and the thing we advocate for, is this last one. Among adults 70 and older with hearing loss who could benefit from hearing aids, fewer than 30% use them. And believe me, I know all the reasons. We can talk about that afterward. But that's a startling fact. And it's actually kind of sad, especially when you think about how important our hearing is, and hopefully a few things that you can walk away with tonight. Here's some warnings Can you hear sounds but not understand the words? Do you ask, have you caught yourself saying, kids nowadays, all they do is mumble? Well, I actually think they kind of do, but they're just be aware of that. Do you have difficulty hearing in complex listening environments, restaurants, groups, crowds? Do you find that the TV or radio is up loud, or do others tell you that the TV is louder? When hearing loss is untreated, it begins to affect how we connect. So it affects how we connect with others. It affects how we listen and enjoy music. It even affects the places that we go. Here's some, I guess you could say, side effects of untreated hearing loss. And some of these may surprise you. Maybe these are ones you're familiar with. The first one is fatigue. And you might say, why would untreated hearing loss lead to fatigue? Well, when you don't hear well, it requires more cognitive effort. So imagine Vanna White up here in a blank puzzle, and you're just getting parts of it. That's what hearing loss is like. You're having to go through your day filling in pieces of a puzzle. You're having to work harder to make sense of what you hear. So that puts an extra burden on your brain or on your processing. So that's why often a person can feel tired because of untreated hearing loss. We often withdraw. If you can't hear, you're not going to enjoy it, you back out or decline. And we know, and I think the best is yet to come in regards to presentations after mine. You're going to hear a little bit more about this, but the risk of not participating and not being socially active is significant. You're at risk for depression, memory loss and decline, dementia risk, and actually increased fall risk with untreated hearing loss. We're still trying to figure that one out. Some recent research has come out and shown if you have hearing loss and it's untreated, you are a greater fall risk. And we think it probably has to do with just keeping the whole auditory system engaged and active, and also maybe just being a little bit more aware of your environment. One of the people that I had a great deal of respect for, a World War II veteran who was kind of active in establishing audiology, has a quote that I've always thought was really relative. When someone in the family has a hearing problem, the entire family has a hearing problem. And so for those of you who either have hearing loss or a loved one with hearing loss, you know it kind of affects everybody. Here's just a snippet of a few recent research findings regarding hearing loss and cognition. There's a correlation between hearing loss and cognitive function. Johns Hopkins has done quite a bit of this research, and recently they found, and you've probably seen some of this just in information presented to you, but when hearing loss is present, you're more likely to develop dementia than those with normal hearing. Effective treatment of hearing loss can slow the progression or decline of dementia. So these are some really important things to kind of think about, and hopefully you'll have a better understanding of that after this evening. So one of the things we don't want to have happen is to go back to this. You've got to do something to prevent going back to a blank slate. And that requires stimulus, input, exercise, whatever you want to call it, of your brain. You've got to keep the auditory system active and engaged. You don't want to deal with deprivation when it comes to your hearing. And that's why when hearing loss is untreated, you're at such a greater risk. So what can you do? Well, I think some of you on your tables have a little paper screen. And that was kind of a little thing we do. We have it on our website as well. It's just a way to kind of ask yourself some questions. about your hearing and if you're having any particular troubles. If you answer yes to any of the questions on that paper screening, it's also on our website, you should probably have your hearing checked. And actually, the recent kind of gold standard is recommended that everyone have a baseline hearing at 50 years old. So if you haven't had a hearing test and you're 50 or older, you probably ought to have your hearing checked. I think it's important to have a diagnostic hearing evaluation with a doctoral level audiologist. Audiologists are trained to do these sort of evaluations, and we're also the appropriate person to refer you if there is a medical need for additional medical intervention. So our training is to be able to determine who maybe needs medical intervention and who maybe needs hearing aid, or who is somebody maybe that we just need to monitor and keep an eye on this. All right, treatment. 5 to 10% of hearing losses are treatable with medicine or surgery. So again, one of the reasons why it's important for you to have a diagnostic hearing evaluation is this potentially could be something that could be medically fixed. And our testing allows us to make those determinations. In other cases, 90 to 95% of the time, if appropriate, amplification is recommended. And I put on this list some different things that a lot of times we don't talk about, but it can be very helpful. And one is just personal sound amplification. Basically, what I'm using tonight is a form of a personal amplification. It's kind of for the group, but there are inexpensive systems that you can have a microphone and it can just go to headphones and somebody can talk in a microphone and you can hear it. So there's very simple, what we call PSAPs. There's hearing assistive technology. These would be things like TV ears, if you've seen the devices where you can wear some headphones that work with your television. And there's all kinds of very good hearing assistive technology. This also includes captioned telephones. So for those of you who are not aware, if you have hearing loss and you have difficulty understanding phone conversations, every state has access for captioned phones. That is something you've paid for in your phone tax all these years. And so if you need captioned phone, your audiologist can help you with that. Over-the-counter hearing aids, this is kind of a new, kind of recent topic. Due to the challenges, and some of this has come about because of the great research at places like Johns Hopkins, is a new understanding of the impact of untreated hearing loss. And so Centers for Medicare and Medicaid, many of our policymakers have taken note because it's much less expensive to treat hearing loss than a fall or the complications of untreated hearing loss like advanced dementia. So getting this done early and having good access for people is very important. Therefore, one of the barriers making over-the-counter hearing aids available. A lot of people have asked how somebody like myself would feel about that. As an audiologist in private practice, we do hearing aids. What do you think about over-the-counter? Is it going to destroy your business? There's been a lot of people have asked me that. And actually, I advocated for over-the-counter hearing aids because we forget there are rural areas where there aren't access to audiologists or prescriptive hearing aids, and something is better than nothing. And we also know the research in the optometry field from years ago. I just would be curious in this room, how many of you started with reading glasses before you got prescription glasses? It's a pretty fair number. And it's not uncommon to do that. The same thing can happen with hearing aid technology. A lot of people are more comfortable starting with something on their own over the counter and then realizing maybe that helped, and then they can move forward into prescriptive hearing aid technology. Finally, prescription hearing aid technology and then cochlear implants. And I just want you to know, even the cochlear implant technology has become significantly improved. And the kind of things we can do now that we couldn't even 5-10 years ago is remarkable. So I wanted to briefly talk about what's called the Better Hearing Pyramid. And this is something we put together just to kind of help people see what's a part of this process. And I don't know how well you can see it from back in Nebraska, but at the very top of this pyramid is you, the person with hearing loss. And the foundation is maybe the style of a hearing aid. When you consult with your audiologist, they should be talking to you about the style of a hearing aid. They need to understand your lifestyle, what you do, how active you are, and that will influence recommendations on the level of technology and your budget, because that all comes into play in here. And then I think it's very important that you work with the right professional. And I want to also make sure we talk a little bit about that tonight. Another way of looking at this is kind of a puzzle. To do well in helping your hearing, there's a lot of different components. And for those of you here, I guess we're in the front, this is your reward. We maybe ran out of some of the handouts, but there's a handout there that has kind of a puzzle looking component. And it basically kind of centers around you, the individual with hearing loss, and all the important components that kind of plug into that. So take a look at that if you get a chance. I want to talk a little bit about the professional, an audiologist versus a hearing aid dispenser. An audiologist in the nation right now needs to have doctoral level training. That's usually 3 years of postgraduate work with a year of clinical externship. So our focus is in diagnostic hearing evaluation, vestibular balance issues, and tinnitus. Those are usually some of the areas that we focus on or specialize in. A hearing aid dispenser kind of varies a little bit by state. In the state of Kansas, you apply for a license to dispense hearing aids. You have to have at least a GED or graduate from high school, pass a test, and then you have to have so many months of some supervision. So we really have very different training and backgrounds, but hearing aid dispensers, especially in different areas of our state, are invaluable. And there are good dispensers, just like there are good and bad audiologists. So I just want to make sure the public understands kind of the difference between an audiologist and a dispenser. And another kind of big difference is the diagnostic testing. An audiologist really can provide you that strong and good baseline. There is also a health model versus a retail. And I am kind of on the health model side. There's Costco and Sam's Club. That would be more on a retail model. And there are differences on what those clinics can provide. So for example, they may be more limited in a retail setting of providing networking with your primary care physician. They may have limitations in wax or cerumen removal. It's also very important, in my opinion, to make sure you always have options. I'm not a big fan of franchises. I think that as a consumer and somebody with hearing loss, you should work with somebody who's independent and making a decision that helps you be at your best and not being dictated by a particular brand of hearing aid. That would be like going to, I guess, a pharmacist and they only sell from one pharmaceutical company. And that wouldn't necessarily serve the public the best. And that's how I feel about hearing aids. Another very important thing about hearing aid technology, especially prescription hearing aids, is to make sure that it's what we call validated and verified. And this is kind of I hate to say it's a best kept secret because it's actually a gold standard, but you should have your hearing aid measured when it's in your ear to see exactly how you're hearing. It's an independent measurement that we use with a little microphone in the ear canal. And this is something, unfortunately, that a lot of people, a lot of professionals who fit hearing aids don't necessarily use this technology. We can fit babies with hearing aids using this technology. So if you're getting a hearing aid, you really should be making sure that it's appropriately verified. Also, this is not something that you just go and get, and then you're just done with that. Ongoing follow-up, regular maintenance. So you need to work with somebody who best ongoing care. I don't know too many people who don't have even just a little bit of earwax, a hearing aid. So if you don't go in regularly and get that hearing aid cleaned, go get that done. That's important. You know, somebody asked how often. I kind of think that's very individual. It depends a little bit on what your personal routine and maintenance is, your capabilities. But I would think I've got patients that, you know, should be seen every 3 months. I've got others that should be seen every 10 months. But I would say at the minimum, at least once a year. This is a picture of some of the equipment we use called VeriFit when we actually verify how the hearing aid is working. And I don't want to get too technical, but it's pretty fascinating. We put a small microphone into the ear canal, and then we put the hearing aid on. And with that microphone into the ear canal, very close to the eardrum, we can see exactly how much sound pressure you're receiving at each frequency relative to your hearing loss. And so one, it tells us exactly how you're hearing speech, and it allows us to make sure that the instrument is set safely, that we're not going to get over amplified. Some success indicators. I don't know what this guy, he must have been in the engineering program at K-State. There are some important success indicators I want to share with you. And I really do feel like, especially if you have more than mild hearing loss, that you should be utilizing a prescription hearing aid. You need to work with a trained and experienced professional. It depends a lot on what your residual hearing is. So I have people that will come in and say, well, my neighbor does so well with her hearing aid, and I'm not doing so well. Well, it's complicated. It depends how much hearing you have. And what your hearing is. So it's not always about the type of hearing aid. It has to do with the residual hearing. How long has a person had hearing aids? That can have an effect on your outcomes. What is your current cognition ability and processing capabilities? That will impact how well you do. Are you good about using hearing aids consistently? Another tip, if you have a hearing aid and you don't use it consistently, I won't put you on the spot, but I bet your spouse will when you get home. You've got to use your hearing aids. And hopefully some of the information we'll share with you tonight gives you a little bit more encouragement to do so. I always tell people there is no harm in wearing your hearing aid. None. Everything I can tell is only good benefit. So keep that in mind. It's important to have routine follow-up. And another thing that a lot of people forget about are good communication strategies. And you may ask, well, what do you mean by that? It's very easy for us to get in bad habits with how we communicate. And this is a little bit more common. I think there's a correlation. The longer you've been married, the greater the opportunity for poor communication. But there's some basic things, and they're not that complicated. Don't talk further away than 6 feet if one of you has hearing aids. Just stop it. It's not going to work. It's only going to cause problems. You're only going to get frustrated. The 6-foot rule, okay? Don't talk when they're in the other room. It just don't do it. It's bad news. It isn't going to work. So these are just some simple examples of strategies that you have to kind of lay some groundwork for. All right, I wanted to end with just a little bit of what's coming, what's happening, what's out in the future, what do we have to look forward to? There's some amazing and exciting research going on, and some of that's actually done at KU. I've got a picture here of my friend, Dr. Hendrik Stacker at KU, and he's looking at some research in how we can potentially regenerate some of the hair cells in the inner ear, which is one of the most common places where we begin to have hearing loss. So that gene therapy and some of the work they're doing there is really, really exciting. There's some exciting work in prevention. So, for example, the military is looking at Sorry.
No, you're
Did it
good.
get popped up? The military is looking at some kind of fascinating research where you can take medication before you're exposed to noise that's actually protective of the inner ear. And if we could do something like that, because when you're in dangerous situations like combat, it doesn't help to have earplugs in and not hear the enemy. I mean, your hearing's important, but I'd still say I'd want to be alive. So this research that they're looking at with the prevention of hearing loss is actually very exciting for us. There's been big advances in technology. And so one of the things that I want to also leave you with is every day, every month, every year, we are seeing improvements in hearing aid technology and cochlear implant technology, which is really game changers. One of the most exciting, how many of you in this room have a cell phone? Most hearing aids now work with your cell phone. Your cell phone can be a remote control of your hearing aid. Another exciting thing is remote microphones. There are now small microphones that can be worn by someone else, just like I'm doing here, the clip on. And that wireless microphone can transmit to your hearing aids. So if you're out with a friend and you're in a noisy restaurant or a group, they can clip on the microphone and it transmits directly to your hearing aids. The same thing can work. You can set the microphone on a table. If there were a group around your table, you can put it on the table, and that microphone is sensitive and it's going to pick up about 5 to 6 feet away, but not so much farther away. So you're going to hear your table more than you will all the background going on around you. So these technologies are available now. And I feel like it's one of my jobs is to kind of educate the public about how fast and how exciting these new technologies are. There's an expansion of implants. So even the criteria for cochlear implants is expanding. We're seeing greater improvement in that. And then, as I mentioned before, the over-the-counter hearing aid technology being made available by the FDA and really approved by the FDA in conjunction with a lot of the professional organizations is actually a good thing. It means more people can get access to hearing help that maybe otherwise couldn't, maybe because of cost barriers, maybe because of barriers in seeing a professional, whatever the reason, it just gives more access to better hearing. With that, see if I get my next one here. Thank you. Maybe that's a hint. This is just a little bit of information about our practice. And we've got some information when you check out here. Dr. Mandy Saylor is our audiologist here in the Manhattan area. She actually comes to Meadowlark the second Wednesday of every other month. So if we could help you, it would be a pleasure. There's also some resources I think Michelle put out either on your table or when you check out of other reliable and reputable professionals in the area and the region that, you know, I also would encourage you to consider. I just want you to get help if you need it. And then, you know, we can't leave without a little bit of humor, and I'll read this. This is actually, I should have changed that so it looked like my sister. Listen up, it says, I think you need a hearing test. And the guy says, why would I need a hairy chest? So this just goes to show you, and I always tell people when you have hearing loss, you don't know what you didn't hear. So you don't want to be caught in that situation. With that, I want to be careful about time. We're going to kind of open it up to any questions here. I think we've got about 5 to 10 minutes, and then we'll be taking a break. So I'll try to repeat the question. Yes, in the back. Will I be making my slide deck? Sure. Yeah, we can make that happen. Went to the trouble of making it. Might as well share it. Yeah. Another question.
What causes hearing loss?
I was prepared for this. he asked what causes hearing loss. When I defended my dissertation, not going to tell you when, just like I'm not going to tell you when I was homecoming king. I will tell you this though, there were only 20 in my class, so the pool was the pool was limited. There were only 2 guys, yeah. What causes hearing loss? When I was defending my dissertation, my son at the time was 5, and I was nervous about it. You know, it was open to the public. It's a public meeting, and my son wanted to go. I was like, okay. So he was in the back with my father-in-law, and I said at the beginning, I'd like this to be very casual. Just ask your questions as we go. It helps me make sure I'm staying on track. And my son raises his hand. And I'm thinking, are you like, I can't not call on him because my faculty are all there. So I was like, yes, Bo, what's your question? And he said, what causes hearing loss, Daddy? It really is kind of the $1 million question. There are many causes, and it's very complex. But in a nutshell, we have risk factors just because we're alive that cause hearing loss, like noise exposure, medications, health conditions. But there's a lot of thinking right now that a lot of hearing loss, I mean, a big percentage, maybe 90%, as high as 90%, might be genetic predisposition. So, that kind of is kind of eye-opening. We do know a few small facts. If you're light-skinned, light-haired, blue eyes, you have greater risk of hearing loss. Has to do with some of our skin tones and how it affects how the inner ear is more sensitive. So it's a great question, and there's a lot of different causes. Other questions? Yes.
And the thing that I noticed is as it progresses, the hearing gets much more quiet. So it my husband said, it isn't for me, it's you. So I went to the audiologist and said, I didn't. Do you have some association with the Parkinson's disease with the lower ability to hear as it progresses?
So I'll try to summarize your question. It's about Parkinson's disease and kind of how that relates potentially to hearing loss. As you know, Parkinson's disease is very difficult and very challenging. And because it affects various parts of the neurological system, that can include the ear. So we do see changes over time as Parkinson's progresses with changes in hearing, but sometimes it has to do more with how we process information. So your ability to hear may be affected, but sometimes it's more along the lines of how clear speech is or how you can process information if you're in a more complex listening environment. The other thing that I find that's very challenging in working with patients, and it really does take patience to work with them, and I know that the person suffering from it is very frustrated, but sometimes it gets very difficult to maintain hearing aids and use hearing aids because of the Parkinson's. Like putting a hearing aid in, putting it on the charger, some of the fine motor tasks get very challenging. Well, so the other part of that is, does the voice get softer with the progression of Parkinson's? And yes, indeed it does, because it's harder for that person to project, to have the muscle strength, the diaphragm strength to project. And that can make it difficult for the people in their lives to always hear it, even if your hearing is good. But it becomes even more important for the spouse or family members to make sure they are hearing as good as they can and not making that an extra challenge. Yes.
You have hearing loss, tinnitus, relate that to
yeah.
I've heard all kinds of stories.
Yes.
So this is back. I don't know what.
I'll see if I can kind of summarize your question or get it correct. So the question was kind of about hearing loss and tinnitus. You can say tinnitus, tinnitus. I think in Europe they say tinnitus. There's no right or wrong answer. but kind of with hearing loss and tinnitus and potentially cognitive decline or relation to dementia. And in kind of a quick, very high level nutshell, tinnitus is usually a side effect of hearing loss, of some kind of damage to the ear. So if you're experiencing tinnitus, the vast majority of people with tinnitus or ringing in their ears or sounds in their ears, our understandings are that it's likely secondary to hearing loss or secondary to damage, secondary possibly to deprivation. So if any of you have heard of phantom pain, you unfortunately maybe lost a hand, but the person still feels the hand, or worse, they feel pain and the hand isn't there. The brain is the same way with your ear. It has, since you were born, it's had a connection from the ear to the brain. If the ear isn't sending a regular signal to the brain anymore, the brain kind of freaks out and it will self-generate a sound. Tinnitus is a way to self-stimulate itself to prevent deprivation. The thing that often concerns me is when people come into clinic and they said, oh, I used to have tinnitus maybe 10 years ago, but it's gone away. What that usually means at that point, and this isn't maybe the nicest term, but we call that a dead zone. There's parts of the ear that no longer respond and the brain won't anymore either. So if you have tinnitus, we usually like to treat it with stimulation. Okay, yes.
What do you think the significance of neural loss is to
Of neural loss to hearing? So her question is, what is the significance of neural loss to hearing? Well, if I understand your question correctly, we tend to call hearing loss a general term. Most hearing loss is sensory neural. Sensory meaning damage to the ear, and neural meaning something along the neural pathway. There are tests, our tests now can actually help us determine more specifically if this is a sensory loss or a neural loss or a combination of both. So both, I'll see if I'm answering it, both neural loss and sensory loss are both negative, but they both can be helped. I mean, hearing aids, actually, a lot of people in the past were told if you had neural hearing loss, there wasn't anything we could do. But a hearing aid does continue to stimulate the nerve. A cochlear implant bypasses the cochlea and stimulates the nerve directly. In some cases, brainstem implants now are bypassing that and stimulating the brainstem directly with sound. So hopefully I kind of addressed your question, but it just goes to show how complex it all is. One more question if there are any, or you can applaud and I'll leave. Yes.
I've heard that the solid core that fits in the ear canal has a negative effect of reducing the normal stimulation of the sensory patch. Is that right?
Oh, you mean like a hearing aid that fits in the ear? So the question is, does a completely in the canal device, a hearing aid that fits down into the ear canal, does it have any maybe kind of downsides to hearing? The most common is, and this is just something to be aware of if you're interested in hearing aids, a lot of people don't want them to be seen. And so they're very interested in, a deep fitting kind of tiny hidden device. As an audiologist, I've dealt with that my whole life. I don't get offended anymore. It used to be like, well, you wear glasses on your face and everybody sees those. What's the big deal about a hearing aid? But the different styles each have different kind of pros and cons. And the ones that fit deep into your ear canal, because they house all the components of the hearing aid, do have a tendency to also act like an earplug. So when you think about it, if you put your finger in your ear right now, it would plug your hearing. So it causes hearing loss. So when you fit that hearing aid, you have to overcome the loss that it created and add on to it your hearing loss that needs to be helped. So those deep fitting hearing aids have some challenges for audiologists because you really have to make sure you get the right power. And all of you know what it sounds like if you've got a cold and your ears are plugged. when you wear those sorts of hearing aids that fit in your ear, it's more challenging because you can sound occluded. If you eat chips or something crunchy, it sounds like your head's going to blow up. So there are some challenges with those. And one of the things I talked about in that pyramid was how we have to understand the style of the hearing aid and how that affects our recommendations for you. I want to just thank Michelle for having me tonight. It's great to see some of my old friends in the audience. I guess when you come in, you know, when you grew up around here, you'll never know who you run into. So thank you for coming. And thank you for your attention. And most of all, thank you for your interest in this important topic. If nothing else, it's really, really important to be a good advocate and a support for those who have hearing loss and help them be successful. So I hope tonight was helpful information. Thank you.
Thank you very much, Dr. Steele. Can you get those papers off the table, please? Thank you so much. Sorry, I ran up to help with the Zoom and I left my notes. And you don't give speech therapists the mic without an agenda, or we don't be quiet. We don't be quiet. That's good English right there. All right. Well, thank you again, Dr. Steele, very much. That was fabulous. Let me just check this really quick from our guest. Okay, so we'll figure the Zoom out here during our little short break. We are going to take just a quick break. I know we are crammed in here, so the best thing is if you need to use the restroom, just plow through everyone in your path. Otherwise, you can just stay in your area, do some calf raises, heel raises, some marching in place, shake yourself around, get the blood and oxygen flowing to your brain so you are ready to hear Dr. Lanzi here in a little bit. We do have some extra food in the back as well. On your tables, every table should have a sign-in sheet. So if you wouldn't mind just putting your name, and if you would like to receive information about our programs, our free memory programs, please go ahead and add your contact information in there. And then also if you do not have paper copies, if you need copies of something, we can help you get those during this time as well. So you can just grab any of our volunteers and we will get those copies for you. All right, we'll take a short break and get ready for Dr. Lanzi.
Yes, you betcha. Let me, I'm gonna stop share for a minute and stop recording. Sure, hope it was recording. Yes, I'm gonna go ahead and stop recording.